We've all heard of the man flu and probably joked about the different presentation in men versus women when it comes to the flu. But have we talked about the different presentation in men versus women when it comes to a cardiac event? If we haven't, we absolutely should. February is Heart Month, and I figured it would be a great occasion to bring some attention to this. In the case of a cardiac event, oftentimes the signs and symptoms in a woman is different than in a man. So you hear of the traditional chest pain symptoms. They may have crushing or a pressure-like pain on the left side of the chest, maybe radiating down the left arm and to the left side of the neck, something like that. However, in women, signs and symptoms can be a little bit more subtle or atypical and can oftentimes be confused as something else, maybe an illness or a sickness. They may have indigestion, heartburn, upset stomach, a headache, maybe a burning sensation rather than an actual crushing or pressure-like pain. I thought I would talk about a call that illustrates this phenomenon. So I was a brand new paramedic and we were toned out for a sick patient. We arrived on scene. The patient was a female. She was probably late 50s, early 60s. I don't remember specifics. And she stated she had been feeling sick for the last couple of days and thought she had some type of stomach virus. So we walked in. She definitely looked like she didn't feel good. She was pale, cool, extremely diaphoretic. She was nauseous and actively vomiting off and on. So we went ahead, hooked her up to the 12 lead. That was extremely difficult because she was so diaphoretic. And this is the initial 12 lead that we got. So as you can see, there's elevation in the inferior leads and reciprocal depression in the high lateral leads. So she was having an inferior MI. So we called the hospital from the scene, let them know what we were bringing in. We loaded this patient up in the ambulance and we treated the STEMI. And I tell this story because this patient truly believed she was having a stomach virus, and she kind of presented like she was having a stomach virus. But chances are, even though there is a chance she may have had something else going on, chances are her heart started giving her clues days in advance of what was going on. And she waited and waited and waited to call 911 because most of what we hear is, oh, if you are having a heart attack, you have chest pain. You don't hear, well, women sometimes present with a headache. They present with indigestion, heartburn, very atypical or unusual symptoms. And the only reason that we consider them atypical or unusual is because there's not enough awareness around it. So as EMS providers, we have to be aware that if grandma has had a headache going on 1 or 2 days, it may be a stroke, but it also may be a heart attack. Mom who has had indigestion and what she thought was a stomach virus going on a day or two may actually be a heart attack. These are things that we have to be aware of and do our best to educate others on.